Hello everyone, my name is Bailey Lobb. Today I'm going to be discussing how we can combat childhood obesity in adolescents. So moving down to the background and significance box on the poster, you can see that 1 in every 5 children in the United States have been diagnosed with obesity. This is a really prevalent issue today, and if we aren't able to get these issues under control, it can lead into other comorbidities as we go into adulthood. Some of these comorbidities could be diabetes, hypertension, potential of stroke, infertility, and even cancer. So moving down to the proposed intervention and supporting evidence, over the last 2 semesters, we've compiled data and research to kind of support our claim of our picket. So my picket for this project was, in adolescence, how can improved physical activity, improved nutritional intake compared to regular nutritional intake and activity improve weight gain or BMI over a 6-month time period. So I was able to find a couple of good articles that did support my claim. So the first one was a non-randomized control trial by Vadir Silva that used weekly sessions of physical activity in a group of adolescents as a trial to see the result on the BMI at the end. Another one I found was a systematic review by Lambrino. So that was a compilation of a couple of different studies, all pertaining to adolescents and obesity, being overweight. They all used physical activity or improved nutritional intake to support their trial. And then the last one I used was a qualitative study by Mohammadi. So this one was pretty unique. It used interviews and focus groups to kind of get research and real responses from the peers that were involved. So they actually talked to stakeholders in a school system and students just to kind of get their feedback on why they think people in their school or their community were overweight or obese, and how they could mitigate that in their school system. So giving them better options in the cafeteria, improving their nutritional knowledge, increasing their physical activity, whether that be in recess or PE class, things like that. Just having that good feedback from real-time viewers and participants in a trial really was a good supporting evidence for this project. So moving down to the theoretical framework, this project I used the Pigot's theory of weight management as my framework. So that is a middle range theory kind of compiled from the assumptions and the concepts of the theory of self-care and then other literacy regarding weight management. So in this theory, there are 3 components that make it up. It is weight contextual factors, so age, socioeconomic status, gender, comorbidities that the people have. Weight management behavior, which is that conscious effort by the participant to improve their health. So whether that be a calorie balanced diet or improving their physical activity. And then the last component is the weight management agency, and that's just trying to figure out what the underlying issue is on why a person is obese. So when we move over to the implementation plan, this is just a little step-by-step on how I plan to integrate this process into my role as a healthcare provider. So we want to first identify our stakeholders, our at-risk patients, our interdisciplinary team, so providers, your PT, OT, dietitians, anyone who's going to be involved in the trial. And then you also want to include their parents. Since they are adolescents, they are still dependent on their parents for guidance and nutritional intake. And then, so moving on down the list, we are going to first, at that follow-up visit, you are going to get baseline vitals on your patient. So height, weight, a baseline BMI. So that baseline data is just going to be something that we can compare to at the end of the trial. Then the next step, we're going to develop our interdisciplinary team, meet with them, figure out our game plan, and then a month later, your patient's going to come back for a follow-up visit. You're going to get them set up with a meeting with a dietitian or a dietary counselor just to improve their knowledge on better nutrition. And then you're going to get vitals again on that visit, height, weight, see what their BMI is. We're going to educate them on the importance of physical activity and get them resources for that. We're going to meet with our interdisciplinary team every 6 weeks to go over data, see any improvements, see where we need changing, see where we need work. And we're going to continue this pattern for a year time span. So our outcomes measured box, we're hoping for our patients to improve their BMI. We want them to have weight loss. That's the whole point of this. So in the studies that I talked about earlier, many of them, other than the qualitative study, since that was just interviews and focus groups, there were no results. Many of them showed significant changes in the patient's BMI. Below is just a graphic of the basic pediatric BMI chart. As you move to the right-hand side, you can see it gets in the red. That is when you're getting into the obese time frame. So moving over to our timeline, it's the same steps as we talked about in the implementation plan, but below is our Gantt chart. So that just really breaks it down over a six month to 12-month time frame on what exactly is going to happen during that time frame. So as you can see, the green, that's us meeting our stakeholders and then setting up our interdisciplinary team meetings every 6 weeks. And then we're going to get baseline vitals at that first initial visit. And then you're going to collect data again the month following. And then as you can see, you're going to have in the orange, your patient's going to come back every 6 weeks to a month to track data, do a follow-up visit, track progress until you get to the 12-month time frame. Then you're going to be able to complete the trial and look back at their baseline data set and compare it to their data set at the end of the trial and see if we have had any changes. The goal is to have a lower BMI, weight loss, better nutritional knowledge, better nutritional intake, increased knowledge on physical activity and the importance of that. So the hopes of implementing this intervention into practice is that we will be able to take little steps over time to improve childhood obesity in our adolescence time or age group to hopefully over time decrease the number of adults who have comorbidities related to obesity. Thank you guys. Below are the references. Appreciate it. Bye.